something that had become increasingly more obvious, especially earlier on, and now at this time, as we're seeing second waves of federal funding enabled through the CARES Act, is communities were really trying to be intentional and quite frankly, struggling with how to strike balance between the immediate crisis response and their long-term planning efforts, especially in a way that did not perpetuate racial disparities and inequity, but instead enabled communities to continue along that pathway of addressing inequity through both resource allocation, community engagement, and a whole sort of plethora of or other strategies that were already being deployed pre-pandemic. What we did see, and you see the national organizations release frameworks that explicitly addressed racial equity and encouraged communities in the face of a pandemic when there's a sort of overarching sense of urgency not to abandon efforts to address that racial equity as they were intentionally intending to for those who were in that bucket or in that boat rather pre-pandemic. And so I'm hoping that you'll have an opportunity to hear from in what Detroit and Washtenaw have experienced and what they have up next, how they were really thoughtful in regards to how to keep racial equity centered in their response and in their planning. And then also, as you see on this infographic, how to not have the crisis response sort of expand to the extent to which there leaves little time, right? There's little time left to do the long-term recovery and stabilization work that we know is desperately needed and actually is an incredibly effective response to the pandemic, i.e. expediting housing placements for folks who are particularly vulnerable and doing all of the planning work that goes into ensuring that that's a reality. So we don't want this infographic, if you're looking at the screen, to come to life. We want you to be able to strike a greater balance between those. So hopefully you get an opportunity to hear about how Detroit and Washtenaw are really starting to do that in the work that they're doing in their communities. So very quickly, I'll elevate some things that we've been seeing by way of national trends, right, with the crisis response. And I can guarantee you that you'll feel threads of those and what you hear from the communities of Washtenaw. In fact, we elevated the experience on several occasions of what happened across the state, especially with Detroit's response. So one thing that we saw was particularly important, and we saw our state partners really rise to the occasion and offer incredible support at the community level around symptom tracking in shelter to identify and manage those hotspots. So to the extent to which there were shelters or part of the community's geography that were hit pretty badly, i.e. you saw a fair number of folks who were highly vulnerable or already testing positive, and that those symptoms were or suspected positive because they had symptoms, but no positive test confirmation just yet. We saw communities be really intentional around really tracking those things. Like just as you would track sites, folks were actually tracking symptoms. Also, right-sizing shelter decompression strategies, right? If you didn't hear about this, you were likely under a rock, right? Folks were decompressing congregate living facilities left and right, as that was a sure bet for exposing multiple folks to COVID if you had any one person positive, given the CDC stats on how quickly folks can become exposed and subsequently infected with the coronavirus. So certainly shelter decompression strategy was top priority for communities across the country. And you'll hear about how that played out in Michigan here. Isolation approaches were particularly key, not just for folks who were confirmed positive, but for folks who were apparently symptomatic and suspected cases too. So oftentimes ensuring that you had 3 different sites for folks identified. Folks for those who were confirmed, folks who were suspected, and for folks who were not symptomatic or even suspected to have been exposed to COVID-19. And in that shelter decompression approach, we saw nationwide, varying strategies, folks using scattered site, folks using congregate, folks leveraging hotel and motels, using a combination of both public and private financial resources to cover the cost of hoteling and moteling folks where that was a strategy that was deployed. And we saw that a lot. And it's interesting to see the shift on the back end now towards communities that are beginning to think about what can they do with those hotels and motels, where some communities have been incredibly creative and purchased those with an intent to transform those units and to transform that hotel and or through a conversion and to a supportive housing project, which is really exciting. So I won't share too much on that, but folks were sort of really thoughtful on the front end. Another thing we saw that was particularly key in the crisis response phase was developing a system-wide testing strategy. So I talked a lot about right-sizing decompression efforts and really getting a handle and command on symptoms. But once folks are in the sort of pipeline, you want to make sure that there is an adequate strategy to system-wide, right, for testing and leveraging where you can those cross-sector partnerships. Those are funders, those are public health. I talked about state partners. The Michigan Department of Health and Human Services, I think, really rose to the occasion and led the pack across the country, based on our observations at CSH, certainly. Around state partners that were partnering very intentionally and around the clock at the community level as well. And then we also see nationwide a lot where there wasn't past relationships stood up with health system partners. We saw that sort of come to life. And where there were existing relationships between the homeless response system and health systems, we saw those partnerships deepen in response to the COVID-19 pandemic. And so we just wanted to elevate ones that are particularly important. And I glossed over the role of funders, but that was not intentional. Funders showed up and played a very, very important role in the immediate sort of crisis response phase of the pandemic, where they enabled the use of flexible funds right through their investment, from everything in basic needs to from PPE to supporting testing strategies and approaches, to also looking at how they may seed permanent housing, investments in permanent housing. I would say that the pandemic really flipped their investment strategies on their head. Funders were really, really responsive and continue to be really responsive to the pandemic. And then lastly, communication. So you'll hear this, I know, in Tara's piece later and in Morgan's: communication. So transparency is incredibly important. And I'm sure you all know and feel that from your seats at the community level. And that was it was interesting that emerged as a national trend, is the level of communication, both externally to stakeholders, but then also internally to some of the core partners, was huge. Communities were having meetings around the clock that were over the weekend. There was no such thing as sort of the demarcation of the work week and the weekend. You folks are probably acutely aware of the fact that this often, like the response, the immediate first couple months of the pandemic required weekend work and required very early and late morning, early morning and late evening meetings. So very quickly at a high level, so when we shift to think about the long term, right? We're committed to helping really illuminate the challenge of striking the balance between responding to the immediate crisis and then also being attentive and intentional around the long-term recovery planning. I wanted to elevate some national trends that we began to see. And we have lots of examples. So, and we can't cover everything in the time that we have. I should have led with that at the outset, but we hope to seed some ideas where you may want more information. You know where to find us after the session. There's a lot of examples of communities investing and municipalities investing in permanent housing through both rapid rehousing and permanent supportive housing. Now, there were certain financial resources enabled through the CARES Act, like ESG CV or Emergency Solutions Grant CV funding, that I know you all know made some types of housing interventions more easily accessible, like rapid rehousing. Supportive housing and permanent supportive housing opportunities require greater degree of flexibility. It required folks to sort of step out of norms and and sort of past practices in the way in which you allocated those HUD resources and envision what you might need in response to COVID and what might be most high impact, right? What may render the highest impact across your community. And so we saw their communities leveraging where they were lucky enough to receive the coronavirus relief funds that expire at the end of this year. We saw communities at the state level receiving general fund allocations, especially communities on the West Coast, making deep investments using those funds, and then a lot of philanthropic resources. So private funding was certainly leveraged to seed investments in permanent housing. And then we also saw the use and continue to see the use of CDBG. So folks really grappling with what it might look like to deploy CDBG or the community development block grant funding in a way that was unprecedented across their community. Here, I'll just cover a couple of the other ones. We saw folks ramping up, right? Housing services for folks who were unsheltered as well as sheltered populations, just recognizing those are the folks who are the most vulnerable, right? As long as folks are housed, they are vulnerable and at risk of coming into contact with someone who is COVID-19 positive. Another thing we saw is some changes to coordinated entry systems. I'll share a little bit about what Chicago did from a policy and procedure standpoint. And then I covered this already, the partnerships between health, public health, and other partners run through the entire continuum of a COVID-19 response, not just on the front end. We did observe many communities across the country, and even at the state level, states begin to drop off once the curve appeared to have been flattened. And now we understand we're in a very different time where we are observing spikes really globally, right? Global spikes. And so it'll be really interesting and even more important for those relationships to be resurrected and for folks on either side of the aisle to understand they really need to be invested in this long term. Okay, so very quickly before I open it up to hear from you all, just for a moment before we hear from Tara, I wanted to elevate, and this is about Michigan communities, so I don't want to steal the thunder of our two Michigan communities, but I did want to elevate some of the work that Chicago did, because many communities, including Michigan-based communities, looked at communities like Seattle, Chicago, LA, who were hit earlier, right, and who were hit in higher volumes and who had been really innovative in some of their responses. So Chicago is one of those communities. I think, if I recall, we saw them very early on, rapidly rehousing folks and transitioning folks into temporary housing locations, utilizing hotels, a lot of hotels as part of that overarching strategy. But what they did in Chicago very, very early on at the COC level was enact some COC or community-wide policies and procedures to ensure that they were all operated, they being all service providers and stakeholders, were operating on one accord across the entire city of Chicago, standing up housing navigators, requiring rehousing plans for everyone. Folks who have been temporarily relocated in an effort to decompress large congregate sites had to have housing plans, as well as a community-wide commitment to utilizing turnover and permanent supportive housing and then subsidized housing, full stop, for this population. So for folks who have those designated rehousing plans, those units that became available through attrition were absolutely prioritized to those most immediately impacted by COVID. And then also, as with other communities, or for all communities, right, who really stepped into this, strategically layering the CARES funding with a lot of local private funding as well. And then on the last slide, the national highlight of Chicago, I just wanted to elevate this largely for your benefit, because we'll make this slide decks available to you all. Just various levels of the strategy, the overarching strategy that the COC deployed in Chicago. So a lot of reaffirmation of low barrier commitments that had already been on the books, but certainly in the face of a pandemic, I mentioned earlier, it's easy to forget about sort of efforts that were underway when you're forced to be responsive to something that we had never seen in our time. And so a lot of what Chicago sought to do at the systems level was just to make sure that they were hunkered down and committed, and even in the wake of the pandemic, to things like low barrier policies and procedures across the state. One thing I'll just pick a couple of these because I want to be incredibly mindful of time. as I'm sure you all are very interested in hearing from our colleagues in Detroit and Washtenaw. Another thing that was particularly interested at the systems level in Chicago was their recommendation on the CARES allocation and standing up a more involved process that was different from their past allocations, right? The funding that was enabled through CARES, besides the coronavirus relief fund, a lot of it was just an infusion of new resources into existing statutory resources. And so in large part, communities had protocols and procedures that they could simply just truncate, right, and get off the ground very quickly. And what we saw in communities like Chicago, and I had similar observations of the work in Detroit and in Washtenaw as well, is communities deciding this is unprecedented. This type of response and process is therefore subsequently unprecedented, and community involvement, stakeholder involvement, and intention to racial equity had to be different. So the approaches there could not be simply a rinse and repeat on how funding allocations were made following standing up funding priorities. And so folks had to be really intentional around what that looked like. And we saw that in Chicago with greater stakeholder engagement, exploring other strategies and housing strategies that had not been previously explored pre-COVID. At the provider level, I'd like to elevate a few things that went into place, because this is where I understand, you can see this one I think may have the most bullets. Sorry, my coordinated entry box is covered. Yes, but you can see this one has the most bullets. And as I understand from my colleagues at CSH who are based in Chicago, is that there was a lot that went into providing support at the provider level. Like folks who were systems leaders were not remiss and were really conscious of the hard work that was being done at the provider level. So they poured a lot of support and attention into the providers, providing support on how to implement many of the fastly released, right? There were multiple waivers being released by HUD, which we were very gracious of as they relaxed standards, but that required a level of support that was needed. Housing provider problem solving sessions, right? If you're on this call and you're familiar with by name lists of folks experiencing homelessness and sessions where folks are discussed and prioritized for housing resources, that was a thing pre-pandemic. But what I understand about what they did in Chicago was they ticked it up a notch, and providers oftentimes needed a different think tank, right, or thought providers or thought partners rather, to really mull over newer solutions to newer and different problems. And so I was very pleased to understand just a little bit more about the evolution of case conferencing in Chicago in response to the pandemic, and then also the accountability plans that were put in place at the team of care level, and that really permeated through the provider network to not just accountability for the sake of accountability, but it was a two-way accountability. Both the support providers needed to implement COC level expectations, HUD level expectations, state level expectations, and so on, but then also the expectations on the flip of what they would need from funders to do that. I'll hit a couple more before I move us along. I'll move over to the landlord engagement, please. Many communities were toying with the idea of, or even standing up and implementing centralized landlord lists that was expedited and fast-tracked in Chicago in response to the pandemic. Getting private landlord stock or housing stock on the private landlord market became even more critical during this time. Certainly engaging elected officials through the mayor's office around calls to action to really put some teeth behind efforts to engage folks in local businesses and hotels to include them as part of the overarching strategy required a certain level of support behind it. And it was great to see that be a part of their overarching strategy. And then lastly, on the coordinated entry front, at the last level, there was a concerted effort to ensure that they were, being really conscious and responsive to the pandemic. And so that meant things like temporarily changing coordinated entry prioritization to ensure, I mentioned this earlier, everyone had a housing plan. They want to ensure that folks who were temporarily relocated and who were top of the list, the newer list, right? There was certainly some overlap with their existing by name list, but policies and procedures and practices more so certainly had to be amended around prioritization to be responsive to folks who were at high risk of exposure or potentially already exposed and testing positive and needing to be permanently housed. So that was one thing I wanted to just highlight and shout out from the Chicago experience. And we have lots of information on what happened in Chicago, so I'd be more than happy to provide, respond to any follow-up questions. Okay. Very quickly, I am going to invite you all. So I talked at lightning speed, and I should have owned that at the outset. But for folks who are not unfamiliar with me, I'm sorry, and that should not feel new. But I wanted to make sure we hold adequate time for you to get to hear from the folks in Washington and in Detroit. But I invite you at this time to use the chat box if you haven't. Hopefully you can access it easily through the control panel. To just elevate if you can. It doesn't need to be lengthy. Share with the group what are the greatest barriers, and you can elevate one, right? To balancing the your immediate crisis management responsibilities with engaging in that long-term recovery planning. And I know we can't go into a lot of depth, and you'll get a chance to hear from Detroit around how they're trying to manage that. But that work of braiding and leveraging resources can often be in conflict, right? And can make it challenging because you only have yet so much bandwidth and capacity with managing the immediate crisis, especially as we prepare for normal flu season and for spikes and a potential third wave across the pandemic. So I'm curious if folks would like to share in the chat, and invite you to share in the chat what some of those challenges have been for you at the community level. I'll just give it a minute, and I am going to jump over to the chat just to take a look, see if what if anything is coming in, perhaps. Oh, look at that. Yeah, we got some questions that came in specifically around using funds, so we'll make sure we get some of those questions answered. Oh yeah, absolutely. So questions around communities using CDBG for supportive housing, purchasing hotels for housing conversion. I'll certainly be glad to share some of those examples. Okay, checking in for CEUs. We got something that came in from Amanda. Thank you, Amanda Sternberg in Detroit. And this is really to tee up the conversation or the presentations from Detroit and Washington, and then also to tee you all up for later during Q&A when you get to ask questions of the two panelists. Okay, so keep them coming as you can think about them. Keep them coming. Thank you, folks. Folks are really interacting. Fear, I love it. Fear as a barrier. Yes. Some of the work that we're doing with communities around how to use resources, the technical assistance, there's a lot of fear. So there certainly is a need to manage fear as a real challenge. So we'll take a look at those. I am going to, I believe at this point, hand it off to my colleague Tara Linzer, who's the Homelessness Solutions Director with the City of Detroit and their Housing and Revitalization Department, to talk about the Detroit experience. Tara, I think I hear you off mute.
Yes.
Awesome. And I will advance the slides. Just, call them out when you want me to move.
Absolutely. Good morning, everybody. Tara Linsner. I work for the City of Detroit's Housing and Revitalization Department as the Homelessness Solutions Director. I've been at the city for just under 2 years. And so I'm happy to be here. For the next slide. So I just wanted to give a snapshot of what homelessness looks like in Detroit. This is from 2018, so kind of take that information in as I'm going over these numbers. But we see just under 11,000 individuals experiencing homelessness on an annual basis. Anywhere just under 2,000 on any given night. Most of our households are single adults, so 60% are single adults. Of those individuals experiencing homelessness, we do have a pretty significant senior population. Seniors over 55 represent about a quarter of our individuals experiencing homelessness. Of those seniors, 33% are chronically homeless, and then we have 20% are 65 and older. So when we're thinking about COVID and our COVID response, knowing that COVID most negatively impacts our senior population, that was definitely something that we were thinking about in our response. And then when we have our beds, we have just under 3,000 permanent supportive housing beds. And our highest night, we have about 1,200 emergency shelter beds, 853 rapid rehousing beds, and then 577 transitional housing beds, although many of those transitional housing beds have come offline because in 2008, they have, since 2018, they were not selected for renewal funding by HUD. And so many of those beds, that number has decreased significantly. And go to the next slide. So in March, when Pandora's box opened and COVID hit, we, I think somebody mentioned the fear and the panic. This was, COVID-19 has definitely been the greatest public health risk that we as a country have faced. And as our work is dedicated to protecting individuals who are extremely vulnerable in our population, there was a lot of things that need to be put in place in a really short period of time. And so while these are numbered, everything was happening at once, basically. And so so basically the first thing we did when COVID hit for our emergency response is that we developed a very strong relationship with the health department, the City of Detroit's health department. Prior to COVID, we had, we knew each other. There was one program that had overlap that Housing and Revitalization funded at the health department. So there was some relationship already formed, but we got to know each other really, really well when COVID first hit back in March, and that relationship has grown and strengthened over time, and that has definitely been a positive. So with the health department, one of the first things we did was try to get guidance out to our emergency shelters and street outreach teams, knowing that we really needed to provide that guidance to them as everybody was very scared and unsure of what next steps would be. And so we started having weekly webinars. I think, honestly, in the very beginning, I think it was even daily webinars, to be honest, check-ins. And then we went to weekly we began starting interagency phone calls. And so that was comprised of MDHHS, our technical assistance provider, CSH, Lindsay Bishop Gilmore. We had CAM on the line. We had HAND on the line. We had Housing Revitalization, our director, Donald Rencher, and then our group executive at the city, Arthur Jemison, was on those calls. Health department officials were on those calls. Basically, it was everybody trying to figure out what the next steps were, and everybody had a role and everybody had a piece, and that coordination was just absolutely vital in order for us to provide as much guidance and assistance to our providers as possible. We quickly realized that we needed to set up a safe place to isolate. And so in Detroit, we did not utilize hotel and motels. And there was a couple of reasons for that. One is when we did our initial projections, we were projected to have like 500 individuals experiencing homelessness contract COVID. Our projections were just off the charts. And that was just because, we're kind of still in this situation. COVID has evolved and changed quickly. What we know has evolved and changed. And so, we try to plan with the best information that we have in front of us at that time. But like all of you know and have lived through, that information changes. And then we have to reassess and reevaluate. And in the very beginning, it was a lot of reassessing and reevaluating. And so, but across the board, we knew, especially from our other communities, that COVID hit a little bit earlier, particularly like Boston, Seattle. We knew that we needed to have a safe place for people to isolate. And so instead of doing hotel motels, because of our projections, the number of people to serve, and in Detroit, we have providers that have buildings that may not be in use. And so one provider in particular, the Detroit Rescue Mission, had a very large facility that used to be a permanent supportive housing program, like an SRO model. And it was vacant. And so we connected with them. We were able to use this vacant building for our first isolation shelter. And that quickly, and then we were able to utilize nursing homes. So old nursing homes that have been vacant have been absolutely key in our response. I'm not sure if other communities have the number of vacant nursing homes that Detroit has. I didn't know we had vacant nursing homes like we did, but we do, and that has been where we have found facilities to use for our shelter type 1 and our type 2 spaces. So, like I said, sorry, I'm jumping around a minute, but like I said, we used the Rescue Mission had a building, and then Salvation Army had a facility that we could use, and that became our type 1 and type 2 shelter space. So shelter type 1, as we call it in Detroit, is for individuals who are experiencing homelessness and who are symptomatic, but they weren't sure if they were COVID positive. And so we needed a place where if our emergency shelters had somebody who had a fever, they didn't have space to isolate these individuals. And so we needed some place where that individual could go, be isolated, get a COVID test, and receive like basic medical monitoring. And so we set up type 1, and that was at our Salvation Army site. And then type 2 was when you've been confirmed that you're COVID positive. And so that is a separate part of the building where you isolate for 14 days. And so those were essential for us to have, and that for our providers to have, so they knew that they could safely refer this individual to a place where they could be still sheltered and receive services, and it would keep the rest of the shelter and the staff safe. Our outreach teams were able to utilize that as well. In addition, we coordinated very early on with our hospitals. We did not want our hospitals to exit individuals who were waiting on a COVID test or who were confirmed positive to our emergency shelters. That was the worst thing that could happen. And so we coordinated very early on with them. We set up a separate transportation line that our whole system could use, that they were able to then call that line and be referred to the isolation shelter at basically anytime between 7 a.m. and 1 a.m. And then that Rescue Mission building that I talked about, that was our very first isolation spot, that turned into Overflow Beds. We had that facility, which had 120 beds, and then we briefly brought online another facility that had about 54 beds. We offlined that because we didn't need it at the end of the day, but we still have 124 overflow beds for our system. And that is honestly because what happens when we have somebody who tests positive at our shelter, as you guys have all probably experienced, is that we have to isolate that shelter and we can't take any new referrals in for 14 days, which means that if we have multiple shelters who are all under quarantine lockdown, we don't have enough shelter beds in our system for people who are coming in, and that's a huge problem. The last thing we want to do is tell people that they have to sleep outdoors. And so these overflow beds have been our safety net so that we can still safely house shelter individuals while we have other sites that are not able to take referrals. The other thing we did was have public health nurses. The health department have nurses that go out 3 times a week to all of our shelters. That started in March and it still continues. They do symptom checking with all of the shelter residents. And then recently, in the past 2 months, we've been able to bring in testing with MDHHS to do routine testing at all of our shelters once a month. And then finally, the City of Detroit has done PPE distribution. So the City of Detroit has received donations for PPE or purchased PPE, and we did a centralized distribution where all of our emergency shelters and outreach teams and congregate PSH programs could go to one location. It used to be weekly, now it's twice a week, and pick up supplies in order to keep their residents and their shelter guests safe. So we can go to the next slide. So some of the new things that we started that came out of this emergency response to COVID was we really strengthened our outreach coordination. We previously, prior to COVID, had an outreach work group, and it was mainly, that group mainly was comprised of our outreach teams that received federal funds and some street medicine teams. When outreach hit, we needed to make sure that we were coordinating with all of our outreach teams, not just the ones that we funded. And the same thing with our shelters. We couldn't pick and choose, like, oh, sorry, you don't get City of Detroit funding, we can't help you. We have to help all of our emergency shelters in our system. And so we did a lot of work with outreach coordination. We were able to get portable bathrooms and hand washing stations set up for known locations for individuals who were unsheltered. And we, like I said, we really coordinated and have continued coordination with all of our outreach teams in the city of Detroit and really strengthened those relationships among those different providers. We were fortunate to have private funding come into play in pretty significant ways. When we were having an issue with clients wanting to leave our isolation shelters, and understandably so, it's very scary to be told that you have COVID or you may have COVID, and then to be in a shelter that you're not familiar with. You can't interact with people and you are stuck there for 14 days. It's not a fun time, especially if we have clients who have, substance abuse issues, mental health issues, or honestly, I mean, COVID is stressful, right? And so we were having a really hard time with some of our clients not being willing to stay in that shelter. And so we were able to reach out to some private funders, and they offered us client incentives. So we were able to provide gift cards to individuals while they stayed at that shelter as an incentive for them to stay there. And we were also able to purchase, entertainment, TVs, games, things that will make isolation a little bit more comfortable. Another thing we were able to do was pay for clients to receive their test results. When we were going out and testing shelters, especially for our more transient shelters, the single male shelters or unsheltered population, we really wanted to make sure that we had an incentive for them to stay where they were while they were waiting on their test result. We did not want to have somebody who tested positive decide to leave that shelter and go somewhere else and then not be able to find them. And so we offer, we still do offer, a $25 gift card if they stay there long enough to receive their test results. And that was really just a way for us, like I said, to try to keep track of as many people as possible. So that has been very helpful with working with clients. Another thing was frontline pay, which before the ESG-CV notice came out for the hazard pay. We were able to use private funding to pay additional funds for our shelter frontline staff, 3 months of pay, and we divided up that funding based off of the size of the shelter and the number of staff they had. And then finally, thinking about how we really need to do better integration with healthcare and our homelessness programs in a way that we haven't done before. And so something that we are still working on getting off the ground is telehealth services at each one of our emergency shelters, and then using Wayne State as a partnership to provide connection and screening for folks, connection to PCPs and screening for folks using that telehealth platform or potentially like in-person visits, in addition to the nurses that were going out 3 times a week. Wayne State really wanted to focus on that long-term care, especially for individuals who were diagnosed with COVID, knowing that they may have long-term health repercussions as a result of that illness. Next page.
And Tara, just a heads up, we're a little bit over, so I'll shift us, and I think you have a couple slides left.
All right, I will try to be fast. Sorry.
No worries.
I always think I have more time than I do.
Exactly.
Okay, so thinking long term, the city of Detroit typically before the ESG CV funds, we have around $5 million.
There's actually a mute button, so you want to keep doing that. So if you do that, give your volume again.
I don't know if you're that. Hello? Can you guys hear me?
Yeah, you're good, Tara. Yeah, well, maybe Lynn from Mishta, if we can do a global mute again, if that happens again. If not, you should be all set, Tara.
Absolutely,
Sorry.
we can.
Okay, so thinking about we get $5 million in ESG, 2.5 in ESG, and we use our CDBG allocation to match that ESG, so total of about $5 million. With our ESG CV funds, for the first and second allocation, we're getting an extra $20 million into our system. And I think probably the greatest service that we could do is have our system look exactly the same as it did prior to COVID when this pandemic is over, right? If we're in the exact same place that we were when this money is all spent that we were before, we have not done our job. And so the city of Detroit can't do it alone. We shouldn't be making decisions in a silo. And so we've began to form this ESG funding priorities group that consists of the COC board, our COC lead hand, our coordinated entry CAM, our TA providers, to really think about what do we need to do differently with this funding, and how do we advance racial equity at the same time. And so in order to do that, we need to, if we want different programs, we need to ask for different things. And so talking about revamping our RFP, looking at what we're asking for funding, what new programs do we want to test out as a result of that, and what do we do differently with the programs that we currently have. Part of this, also we had a new investment in prevention and diversion in order to try to keep people out from entering into the homelessness system. And so we also had $4 million of CDBG CV funds that went to eviction prevention services. And then we really ramped up our diversion program. Prior to COVID, the city of Detroit invested $150,000 in flexible funding for diversion. That program, while diversion had always existed, those funds, we fast-tracked that contract so those funds could be available when COVID hit, and so that they could really have whatever kind of funding that they needed to keep households out of emergency shelter. And there's a session either later on today or tomorrow that Detroit's CAM can talk about. We can go to the next slide. So we wanted to, with this additional funding, we wanted to build our systems capacity in two ways. One, improve our systems capacity by providing technical assistance to our current providers. And so the city of Detroit has two TAC staff, technical assistants, I forget what the C stands for, but two TA providers that are working with us. And so they have done some surveys of our providers to try to see what additional training that they need in order to provide the best services possible to our clients. And then we wanted to get new partners into our homelessness response system, and we were able to accomplish some of that in the RFP that we published back in July, and we're hoping to get new partners in the RFP that we publish in the upcoming weeks for the second allocation. And then, like I said, improving communication. That communication is going to need to continue throughout the COVID pandemic. so that our providers are able to ask questions and we're able to relay information as things evolve and change. Next slide. Okay, so a couple of things that we are doing for the long term is we are, like I said, we're trying to prevent people from entering into the system. In our first allocation, we dedicated about $1.5 million in prevention. And then in addition to that, the $4 million of CDBG CV, a pretty significant investment in keeping individuals and households out of the emergency shelter system. We're also, with a second allocation, we're also piloting 2 different kinds of rapid rehousing programs. So the first is light touch assistance. Basically, households that can't be diverted enter into our shelter system, may score low on the VI SPDAT, but really, if with just a small amount of assistance, first month's rent, security deposit, maybe help finding a unit, they would be able to quickly exit the shelter. And so we want to, if we're not able to divert them on the first time, we want to be able to provide them that really small amount of financial assistance to quickly get them out of emergency shelters so that we can, hopefully end their homelessness and, make sure that we still have shelter space for individuals that will need longer rapid rehousing services. The other thing is really focusing on that system-wide landlord engagement. Right now, all of our rapid rehousing providers have to identify their own landlords. And what we really want to do is centralize that, have one team that is looking for all available units throughout the community and is able to provide that landlord and those units list to our rapid rehousing and permanent supportive housing providers so that we can cut down the amount of time that people spend searching for units and instead be able to, quickly house them. And then looking at the length of time between referral and house for permanent supportive housing. So I'm just gonna, go quickly to the next slide because I don't want to short Morgan. Okay, and then that's
you're all set.
Great. That's my contact information. Feel free to reach out to me with anything. Thank you.
Awesome. Thanks, Tara. Awesome, folks. We'll hand it off to Morgan to hear about the Washtenaw experience, and then we'll open it up in the remaining time for questions and answers. Morgan, take it away.
There we go. Greetings, all. Thanks for being here. Just going to give one little caveat. I have a very big dog who likes to walk up on me and behind me at a random's notice. So if you see a dinosaur behind me, it's just him. I'm safe. My name is Morgan Boyston. I'm the Human Services Manager for Washtenaw County Office of Community and Economic Development. Next, Mercedes. So I wanted to briefly just go over the role of the Office of Community and Economic Development, and that we are not just the COC lead for Washtenaw County. We also serve as the Community Action Agency as well as the Washtenaw Urban County, which means that we had multiple pots of funding to address that came in as a result of the pandemic to address homelessness and other areas. So the matrix that I'm going to show you for our funding, kind of what we call funding weaving, includes multiple pots of funding, not just COC, HUD, or ESG funding. And so the mission of the OCED is, even though we are a government department, local government department, we do try to address all of, I guess, the programming efforts that we attend to through an equity lens and in a non-governmental traditional perspective. There's a lot of traditional things we do as a government office, but we also try to work outside of that. So hopefully I'll speak to a little bit of that as I present. Next. So this is some of our 2020 COC highlights. As of September 30th, there were 376 people experiencing homelessness, which is a decrease of about 20% from 2019 around the same time. I would attribute that to the eviction diversion program. We also have a local funding pot in Washtenaw County called Barrier Busters, which is a crisis prevention funding, and that if someone's in current crisis, we can give some funding for things like car repairs or groceries, or even we can give funding or supports to folks that might be doubled up in housing. We can give them assistance for their rent through that funding pot, and that's funded by various municipalities, city municipalities, as well as some philanthropic funds, as well as some donations, as well as some general funds from the county. So this is not necessary to say that we are doing an amazing job at housing people, just saying that we have a lot of other resources in a non-traditional way in order to support people in crisis. As of September 30th, we did have an increase in the amount of time it took to house folks from 128 days to 145 days. I do attribute that again to the pandemic and just specifically the shelter in place. A lot of, as I'm sure you all know, they're just the inability to see property, to work with folks directly in order to get people housed was limited. Also, though, as of September 30th, we housed a total of 442 people. Again, that is a decrease. I'm not really sure. I'm going to be honest with you. This is a little misleading. At the same time, I think last year we housed about 603 people. So we are a little bit under the target, but still, given the pandemic, I think we are well within, we're proud of ourselves for the amount of work and the way we've been able to house people during this time. And then as of September 30th, there were only 2 COVID-19 cases across all the shelter sites, though just recently, shortly after we presented this information out to community, there was 1 more positive shelter case in one of our permanent supportive housing, permanent supportive housing, not facilities, but locations. So today, about 3 cases. Next, Mercedes. So this was our COC COVID response timeline. This is in retrospect. This is not at all, was not planned out to work this way, though I guess towards, if we look at where we are currently in October time, which I did mark here, we are currently trying to calendar out and be a little bit more strategic around how we address the long-term COVID response. But one of the things I do want to note that allowed us to be more forward thinking as we've been responding to the pandemic is actually 2, I think, significant reasons. One is that my previous role before working with the county was to work within the health system and with adolescents in a health clinic. And so I had come into this work with, I'm by no means trained as a public health personnel or don't have that educational background, but I did have health and pandemic and ways in which to address health issues at the forefront of my mind. And so in February, before there was a large increase or outpouring locally in Washtenaw County around COVID, positive COVID cases, my mind was already there knowing what was happening globally. And so February, I did start having conversations with health department and with local homelessness providers around what would they do should a pandemic come to Washtenaw County and should we need to drastically change the way we operate. I do think having those early conversations before it was actually a crisis, it was just a looming crisis, did help with some of the fear that was just naturally experienced from us all, and that people had a plan, providers and community had a plan in coordination with the health department before there was actual real need we could see. So because of that, very early on in April, we were able to start conversations around shelter expansion to hotels. So at that point in April, we still had some congregate sites operating in churches, but we did significantly expand the shelter operations for individual clients into a local hotel, as well as we still had beds available at our local individual, or we still operated the local individual shelter, and we de-densified that space. So I think by the end of the hotel expansion, which is actually still going on now, we are scheduled to move out of the local hotel that we've been using as the crisis response November 2nd. So over time, we prioritize the hotel beds for those that are highest risk for COVID because of health and because of age, as well as we did our best to prioritize hotel beds for those that didn't need such hand-on supports, though there was significant damage to the hotel as a result of just the way that we were using it. And so there's pros and cons to expanding into the hotel, though we were able to safely shelter a lot of folks during this pandemic. It also provided the opportunity, I really think, contributed to the decrease of the spread, and that we were distanced. There were no more than 2 people to a hotel room. And similarly at the Delana Center, where our individual shelter is. And we still operated family shelters, but those, while they have some congregate spacings, a lot of them have pods or even have separate isolated places, units for folks, for families to shelter in. So the family shelter process wasn't in crisis mode, though I do think one regret looking back is not being able to provide hotel beds for families and for youth. So moving forward, that is something we're thinking about and doing. Also, throughout this whole time, we knew that we would have additional funding coming into the system. And so rather than focusing on sheltering folks, we really intentionally wanted to prioritize funding for all the various different gaps in our system and permanent housing resources that we knew inevitably we would need. And that from the onset, and part of the equity lens that we try to maintain in Washtenaw County, is that sheltering folks is a bare minimum. We are always looking to permanently housing them. So that brings me to my second point, in that while crisis shelter was absolutely important, we clearly enlisted a hotel, and we did everything we could to set up procedures and processes so that we were triaging those for symptoms before they entered into shelter spaces. We still always, our eye was on permanently housing people and not sheltering them. And what else do I want to pull out from this timeline? We also did significant, along this time, as we were having various conversations, my colleague has already mentioned, there was multiple meetings every day. Mercedes mentioned this too, weekend hours, talking to each other while in meetings and other meetings. There was constant communication. So while that was all happening, we were also tracking, the team and I were tracking every single innovative idea that could support in housing people. There was no idea that we did not put down, even as ridiculous as it might sound, because we knew these additional funding coming in, while also being flexible, would be what are more flexible than what they normally are, would allow us to do some innovative things that in the with regular ESG, HUD, COC funding, we would not be able to do. So while we were not putting anything into implementation, documenting every idea was absolutely essential in helping us to move this work forward. So as you can see, in July, we engaged with CSH around what a system strategy could be to permanently house people, as well as we began to think about more broadly how to engage the board around housing folks and not necessarily only sheltering them. August, we also launched a prevention tool that would help us to be able to prioritize all the additional funding that was coming into the system so that we were making sure we were hitting the populations that were most in need and most impacted. Locally in Washtenaw County, the health department very early on in the pandemic released data that showed that Black folks were being highly and disproportionately affected by the pandemic. So it became very, very early on known that not only do we need to permanently house people, but we need to make sure that we are prioritizing those populations and communities that were most hit. And so again, we wanted to launch and pilot a prevention tool in order to really help us to prioritize the resources to the right populations. And all throughout this, both June and last meeting was in September, we also knew that diversion was going to be crucial, and that in order to keep people housed, we need to divert them truly from the homelessness system, which means we need to figure out exactly what is causing their housing insecurity or crisis. So we engaged with Cleveland Mediation to provide a training for local providers who will serve as the coordinated entry points in the system, as well as in September, we held stakeholder diversion trainings for those that are not necessarily in our homelessness system, but those that are tangential to them. So that means like our education system. What does it mean for all the various school districts that participated to know what it means to have housing first, but also divert folks from the homelessness system, and that we all know entering into the homelessness system is not necessarily a good thing. If we can figure out ways to solve your crisis, even if that means providing a resource, like I said, through barrier busters, then that should be our first option rather than entering someone into shelter and then resources. Though we also wanted to make it a point of knowing when it's time to provide resources to folks. So that was happening in September. And then Mercedes, can you go to the next slide? I'll move us on so you can see an example. Oh, maybe not this slide. That's okay. We'll stay here. And then we also prioritized funding through this matrix. And when we go to the next one, you'll see current funding priorities. But we wanted to start to build kind of a matrix or a weaving of all the additional funding that we've gotten into the system. And so as you can see at the bottom, the total additional funding was about closer to $7 million. And we started tracking all of the funding pots. Now, this served multiple purposes. Again, we are a local government office, so one of our priorities is to provide all the additional funding to the Board of Commissioners. So very early on, we had to track and we had to be able to explain where this additional funding would come from. And then also it became really necessary to make sure that we were covering all the various projects that we knew that needed to happen in order to really address homelessness. So as you can see, our very first award that we got was the HUD ESG Round 1 CV, and as well as the MISHDA HUD ESG Round 1, and then a second HUD ESG CV Round 2. And so that was both of those, all three of those have gone to assisting with rapid rehousing assistance. So expanding that program a little bit for those that we put into the hotel shelter. We wanted to make sure that, again, our goal was not just to shelter them, it was to get them stably housed. So those folks were prioritized for rapid rehousing assistance, as well as we provided funding to barrier busters, again, to help with some of that diversion efforts. Inadvertently, we weren't necessarily calling it diversion, but that's what it ended up being. As well as we wanted to provide, what we did not know was happening was we were going to create our own local eviction prevention programming so that we could attend, again, as upstream as possible to prevent long-term homelessness. And so that was a gift and a curse, and that while we were innovative in creating that almost a week later, we were given over $1 million in order to actually have the statewide eviction diversion program, which is working out in the end in our favor, and that we will spend the statewide program money down. And then when it ends in December, January, we will just transition over to the local program. It might be a little different, and we will have to incorporate that prevention tool, but we will do that. And then as you can see, and feel free to follow up if you want to have a little bit more details of this matrix. This is not the complete version, but we also had ideas of, and that RFI has gone out to community doing a mortgage assistance program, as well as using CSVG, which is through the Community Action Agency funding also. If you could move over to the next one, Mercedes, that would be great. And so then this, based off of that matrix that we created, and based off of the fact that we were tracking all the various programs that we knew could be innovative and could be helpful in actually getting people housed, we launched what ended up being these 6 programs for future funding. So this was definitely a prioritized list that had about, I think there were over 15 different projects or ideas that we'd been tracking over the 4 to 5 month period when before we started to actually prioritizing how we would use them. And so this is the result, and this is what we launched for our RFI. That's actually, we just closed it. I think that was on Friday. So Community Housing Navigator, again, it was one of those grandiose ideas that in normal times, without having the additional money, felt like it wasn't something that our system could viably do, that we decided we need to have it. Again, in order to keep people out of shelter and stably housed, we need someone that can help people navigate just the county in general housing market. Where could they find affordable housing? What are the best ways to talk to landlords? All that good stuff. We also are prioritizing diversion housing problem solving. So what would it look like to actually have a person in the system whose job is to divert people from the system? We wanted to look into what it would look like to maintain housing choice vouchers. So for those that have HCVs that have to do reaccreditation, they have to reapply, they have recertification, and for those that have housing choice vouchers but want to move and have a limited time to figure out a new unit before they lose their voucher. That was a needed additional staffing role that we needed to have in the system. And so we are going to prioritize funding that role. Rapid rehousing expansion, I think that's pretty explanatory. Hotel motel voucher. So while we can no longer sustain hoteling every single person in the system or every single individual, again, in the system that's in need of shelter, we can prioritize for certain high acuity populations. And so we wanted to make sure there was funding set aside for those hotel motel vouchers for folks that would not fare well and should not be in a congregate setting due to health impacts, behavioral, and just basic needs. We wanted to make sure we had that resource set aside, as well as another gap, and that, is for both, as you see, for families and singles. And then another huge area that was missed previously that we're hoping to use this as an opportunity to address is youth-specific services. So what does it look like to provide prevention resources for transitional age youth who are entering into our homeless system, as well as diversion services, as well as expanding rapid rehousing for that population? So currently, again, we received proposals. I think there was about 9 proposals that came in that address some of these, if not all of these things. Rapid rehousing, number 4, while we asked for proposals for that, that is not a priority for funding for this round. We were hoping that in advance of funding that'll come down. We all know that there's going to be another MISHDA CV allocation coming. We wanted to make sure that we could be ahead of the game again, right? So how many proposals could we already have in line, ready to go, to just allocate those funds out to community versus having another process to figure it all out? Next, Mercedes.
And just a heads up, we have about 5 more minutes before we open up for questions and answers.
Okay. I wanted to just briefly touch on the prevention tool that was piloted and created in Washtenaw County. We are really excited. And again, it's going to help us to be able to keep people housed long term and to make sure that we're prioritizing the funding that's coming in for the right communities. In Washtenaw County, we have something called an opportunity index that really helps us to understand what opportunities are available to folks across the county by zip code. So what is the employment rates in certain zip codes? What are the health outcomes? What are the transportation, how is transportation accessible? What are the education outcomes in certain zip codes? We used all of that in order to prioritize a prevention tool, as well as we used COVID from CDC recommendations. We used high-risk COVID information in order to prioritize funding, as well as we wanted to make sure we also used age as a prioritization. Again, acknowledging that in the beginning, the aging population was at most risk, right? And then we found out Black and Hispanic populations. So we wanted to prioritize those populations. The tool was based on an evidence-based tool already used in New York. And then incorporated with our local data. We vetted it multiple times with community and providers. It actually took about a month and a half to really create the tool and to make sure that there was some buy-in. In the end, we launched it in August. It was great. We adjusted it over time, having gotten feedback from both clients and staff and community partners as it was being implemented. So we changed it multiple times over that, say, 6-week period. To figure out that come September, we were having a hard time due to capacity spending down the eviction diversion funds, which is where we piloted the tool first, and we wanted to make those funds as flexible and as accessible as possible. So while the tool really worked and it prioritized the populations that we were wanting to, it was prioritizing a little too much. So we suspended it for the rest of this eviction diversion process, acknowledging that when the funding is limited, so for instance, that local eviction prevention program that we'll be launching in January, that it's probably going to be best used then when the funds are much more limited and we have a much bigger need because the moratoriums will be over. So again, it was another way of doing something in advance to use when the actual crisis happened instead of waiting for the crisis to happen to pilot something like this. Next, Mercedes. And so what I've already talked about, for me at least, feels long-term and more towards focus to recovery and stabilization, but we have even longer-term goals that, again, with the support of Mercedes at CSH, we have been working on. So what are equitable best practices for permanent housing across our system? We are really going to look into rapid rehousing. What does it look like to extend the program, give extensions for rapid rehousing? Locally, we have 12 months as the amount of time that we provide rapid rehousing, with the option to extend if needed to. But what would it look like to extend everyone's rapid rehousing, or those that are having a hard time because of lack of work, because of lack of childcare, because of the local school operating how it operates in the pandemic? What would that mean for our system to extend that and also expand rapid rehousing? In an equitable way. We also are looking at triaging and are going to be presenting out a process for face-to-face case management, and that not everyone can just work remotely from home and not every client can be served remotely, that there's a reason people are in PSH, and so that reason is they need more hand-holding. So when another outbreak happens, how do we do that in a way that's actually equitable so that people that are highest acuity still have that face-to-face contact in a safe way without spreading the virus, but still they get their needs met? We're also going to be working on COC board activation and engagement. So we're planning for our board retreat, as well as engaging larger community and stakeholders around, again, what does diversion from our system mean, and whose job is it to divert? Is it just the homelessness system's job to just solve everybody's homelessness, or is this really going to be a community effort? And then also, again, is that intentional equity overlay, and that everything we have done in this system is about equity. equity. And that, again, it's not equitable just to shelter, it's equitably to permanently house people. That is always our goal. So we're going to be continuing to do that, as well as provide an M&A, the Michigan Nonprofit Association Equity Assessment, to all COC core providers, so that they can see internal policies and procedures that are affecting their ability to provide equitable services, as well as engage with white leaders in the system around racist, anti-racist work, and as well as doing a anti-racist peer learning group. And next, Mercedes. And sorry, I'm talking really fast. We'll get on this later. I just wanted to show you, we did do a little bit of crisis planning with the winter shelter, of course, and appropriately. But this is, as you can see, what we did in Washtenaw County versus what other communities have done. But I won't spend a lot of time on that now. Mercedes did a great job in covering that in the beginning. And then lastly, the lessons learned was that my main one, my mantra is the master's tools will never dismantle the master's house. You have to do it differently in order to solve the problem. And so one of the lessons learned is the more community involvement, the better. Use your advocates to help you move along the homelessness response that you're trying to do. Use them as best as possible and be as transparent about the barriers, the needs, and the success of the work that you're doing, so that you can mobilize the people whose job is to advocate. Keep track again and document all your innovative ideas. There is no such thing as a bad idea. There is just a such thing as bad timing. So discarding those ideas do not help. Just knowing when to implement them does. And lived experiences should drive the decisions. Data is great. Data but should always support what lived experiences already told you. That's it for me.
Awesome. Thank you, Morgan. Here's Morgan's contact information. As we shared Tara's earlier, I know Morgan and Tara had a lot of really dense information to share about their experience in balancing and attending to both the immediate crisis response and doing the long-term planning work. I can appreciate if you were unable, right, and understand if you were unable to sort of lock it all in. But you don't have to. You can be in contact with either Tara or Morgan or both of them to get more in-depth information around their local community-based experience. I know at this point, let's see how we're doing on time. We're a little short on the Q&A, but we do still have time. This session officially goes until 12:15. So I would like to take this opportunity to open it up for questions and answers from the audience. We'll take a look at, see how many folks we still have with us. Some folks might have needed to drop off. Looks like we still have a decent number of folks still in. Yeah, very, very decent. So let's take a look. I know folks are globally muted. We have over 70 folks still on the webinar. So we open it up to actually allowing folks to, or maybe we could, if folks could, yeah, I think I will regret that. It begins to get really tricky to manage. So I'll go ahead and take a look at some of the questions that have come in and kick them to Morgan and or Tara, just depending on who they're directed. And I'll just go from the bottom up, if that's okay. Folks, a lot of kudos, thanking folks for going through the topic, calling out how accessible it is, especially for new folks. One of the first questions that came in is what resource, this question is from Sharon, what resource did you use to determine the need by zip code? This might be directed at you, Morgan, and can you share the tool itself with Ingham County? So Morgan, I'll open it to you to maybe respond to that.
Yeah, so we, again, locally in Washtenaw County, we have something called the Opportunity Index that is actually in process of relaunching for this next iteration. I think the first launch, and this is when Mercedes was in the role a little bit more closely, I think the first one launched in 2016, 17-ish. And so it used census data and zip code in order to track the opportunities in those areas. I can definitely provide the current link for the Opportunity Index that shows that. It's an interactive mapping source where you can kind of decide, I guess, which area you want to see and the outcomes in that area, the opportunity outcomes, and a new one will be released soon.
That's great. Thanks, Morgan. And we can share the copy of the New York tool that Washtenaw used to base their local tool off of as well. Tara, did you have something?
Yeah, I just wanted to add. We also with our prevention, we are prioritizing certain census tracts, and we're using data from the Urban Institute, their emergency rental assistance priority index that includes like housing instability, COVID-19 impact, and equity. So I can also just throw that in the link too as another resource to look at.
That's perfect. Thanks, Tara. And I see some questions around slides. Yes, we will absolutely make both the recording and the slides available. So I know that's part of what Jason is hoping to do once all of the sessions have been wrapped. Just looking to see some of the questions that are coming in. It looks like we have one where the place is staffed. So these locations, we talked about locations being stood up. Were they staffed? Where did you get the staffing for the nursing home? So Tara, this one's directed more towards you.
Yeah, so HRD actually hired staff to run the shelters, knowing that our providers were pretty tapped out, just operating their own emergency shelters. So I hired staff to operate the shelters, and then the health department hired staff. And so it was jointly staffed and operated by the health department and housing revitalization. And it's going to transition to be solely in the health department's realm in the next month or so.
Yeah, thanks, Tara. So a lot of questions in the chat around veterans. So it may be worth elevating some of the practices that might have been subpopulation specific, particularly around veterans. It looks like there's at least some conversation brewing. It's a little bit further up around veterans, so I don't be hard to sort of follow the thread there. So forgive me, folks, for not doing a good job there, but I think we can try to assess those out. We can take a recording of the chat, which is great, and see if maybe a FAQ could be pulled together to respond to the questions that were inevitably coming in during the report outs from Detroit and Washtenaw, especially around the question I asked earlier, to see if there's another quick one to grab down. Okay. Perfect. Thanks. Tara shared the Urban Institute resource that they use to prioritize by geography in Detroit. Thank you. Okay. I think that of the ones that we could probably realistically take in the next couple minutes, though, that's probably it. Oh, maybe one final one. Look at this one, a shorter one. Maybe this is for you, Tara. Were folks transported to the facilities for the 3 sites? And maybe even you, Morgan, too. I know you all use the hotels in Washtenaw County. Was there transportation provided to staff, to clients, rather?
Yeah, so in Detroit, we got under contract with a company called IntelliRide, and we hired them to basically transport clients and then have their vehicle sanitized after transport. So we had to provide a safe way to transport people because we definitely didn't want somebody who was symptomatic or COVID positive to be taking public transportation. So that's the contract that we currently have and we'll plan on having as long as we have an isolation shelter.
Yes, we also provided transportation. Both the shelter equipped their van transportation for COVID protection. So, and we used CMH, community mental health transportation vans, also to get people back and forth from the shelter to the hotel sites, as well as a local business owner also supported with some transportation as well.
Thank you, Morgan. So I was looking, there was also a lot of questions and commentary around the use of hotels for sites as well. So a lot of good information that we'd be more than happy to provide around that. So we'll scan the chat, try to collate and pull out some themes with the questions and see what we might be able to share with folks. But I'd like to take a moment in the last minute to thank the crowd, right? We had a good showing. Folks, hopefully you had an opportunity to at least hear the tension, right? The balance between attending to both the immediate crisis response, especially with the second wave and normal flu season quickly approaching, as well as attending to that long-term recovery planning that Detroit and Washtenaw spoke to, as well as the national examples that I elevated. I know we did not nearly have enough time, so we will share as much information as you folks would like to reach out and request. You will have our contact information in the slide deck when it gets posted. But hopefully you've been able to take our names down if you need to reach out to us in advance of the information being made available on the website. But thank you all so much, and have fun and enjoy the rest of the first ever virtual summit.